Sean, you and I are fortunate to have health insurance. It's so important. I mean, our health means everything. But the interesting thing is during 2020, so many of us are avoiding medical appointments just because of COVID and the
Yeah,
fear of going anywhere. But now there is a way in the Valley to rest assured that everything from here to here is going all right. And we have a
absolutely.
doctor about to join us.
Yes, Dr. John Pierce is the medical director with Preventative Diagnostic Center, getting a peek inside, under the hood, taking a look what's going on in there without actually going under the hood. Doctor, it's great having you.
It's great to be here, and boy, I love how JJ just kind of framed out the areas that we can look at, and she's absolutely right. Just below the chin, right on down through the pelvis, we can see all the organs there, to include the thyroid, right down to the prostate in men and the ovaries and uterus in women, pretty much everything in between. So.
The technology is really amazing, and it's saved lives as well. You're not going inside, though, to take a look. You're taking a look from the outside in.
Absolutely. We have a very, very high definition CT scan. It's very unique to this area. I think the only one is close by is up in Palo Alto, up by Stanford. So
Mhm.
what's unique about this CT scanner is it actually measures the individual who's getting the scan to only give them the lowest effective dose of radiation, allowing us to get the most precise images such that we can see any abnormalities down to about the size of a grain of rice.
Wow.
Yeah, and it really is something. And that is something I asked about, Dr. Pierce, when I came into preventative diagnostics. I said, look, I'm all for getting this test. I really appreciate having this peace of mind. However, I'm concerned about exposing myself to radiation. So you calm my fears in that way. I also found that it was amazing. I know I pointed out, from here, and then my other hand is down just below my groin. I was amazed at how many things you can actually detect in this scan.
Yeah, pretty much every organ system outside of the brain. But we're looking at the lungs, the heart, really specifically outside of the heart. We're looking at the coronary arteries as well, so we can see if there's any plaque buildup there. We can see the liver, the spleen, the pancreas, the blood vessels that feed all of those organs. And so, again, we're doing a complete organ system check, and we're going to be able to see things a lot of times long before a lab abnormality would show up.
Yeah.
In very many instances, long before anybody develops any symptomology. When it comes to things like
Mm.
cancer, we've caught a couple of those cases. People are otherwise feeling very good. We catch a cancer early, and early diagnosis yields much better prognosis
Yeah.
in cancer, for
No
Yep.
sure.
question. And there's another big thing, too, and this is the one that I think gets swept under the rug, but heart disease, that's the number one killer. It's, they call it the widowmaker. It's kind of like just a little bit of it's silent. Like you don't see it coming. And then when it happens, it's almost too late. This can
Absolutely.
catch this.
So, yeah, you're 100% correct. If somebody has coronary artery disease, a lot of times the first sign of that is that heart attack. God forbid it is in that widowmaker. It's called that for a reason. Generally, those are fatal heart attacks. So we can find plaques long before they rupture. And if they're there, we generally send people off for further evaluation from a cardiologist, because they can then tell if that plaque is impeding blood flow to areas of the heart.
Hmm.
Yeah, and it's kind of amazing. You have this network of professionals who's reading that scan. I know when I came in and got my scan, I'll be honest with you, until I found out those results, I was just about that much nervous, because you never know. You never know what could have been detected. So tell us about your role in all of this, and who follows up on the information.
Well, that's exactly my role. I'm the medical director at Preventive Diagnostics, and my main job is, besides making sure everything runs smoothly, is to be the call to the patients after the board certified radiologist reads the scan. And if there's any abnormalities, I want to call the patient before we send them the results to rest them at ease, because people don't understand medical terminology, and I don't want them to read something and get scared. I
Yeah.
want to prepare them for what they might be seeing and make sure that they get to the right pathway to address it. So either their primary care doctor or a cardiologist in many circumstances.
Really quickly, a special right now for some that would like to come in and have this done for themselves.
Right now, we're offering for couples basically a 2-for-1. Come on in, and we do this coronary artery calcium scoring with a heart scan for $125. generally that's $599 per individual. So
Excellent.
heck of a deal.
Thank you so much.
It's great to have you, my friend. Thank you for joining us. And yeah,
Thank
take
you.
advantage of that deal. Heart scan with the calcium score for $125. Usually it's $599. Go to pdcenterlv.com or call the number you see right there on your screen. Preventative Diagnostic Center, a proud sponsor of the Morning Blend.